what is your outlook on the primary healthcare setup in the UAE?
First of all, I'm very happy to be here. I think that the UAE is an amazing place by all perspective. We can look at the progress that the UAE are making in all the different facilities. We're sitting here, you can look outside, you can see the amazing sites that are outside. And now the UAE is making the advantage on the next frontiers. And the next frontiers is the science and the healthcare provider here in the UAE. And looking at the amazing progress that is being over here, I'm quite sure that the UAE gonna be one of the leading centers worldwide with everything related to health and medicine. And actually by some territories, you are already in the frontiers. And this is part of the reason why I'm here.
Okay. And how do you think of having conferences like IFM will help the healthcare industry in the region?
The family physician or the primary care physician is probably the pivotal medical entity or representative to the patient. The job of the primary care physician is to take the high-end science development that we have in healthcare and to translate that to the patient in a way that he can understand. And that's not an easy job. The challenge is for the primary care physician is to be kept update on all the frontiers that are happening, which is not easy. To be able to understand it and to be able to translate it to different patients, and different patients are at different level of understanding. So the IFM is tackling the first part, bringing the frontiers of science, of medicine, of the development that were made during the last year. And there's a huge amount of new science and understanding. Understand the core of it, and then the next job that they have is to take that and bring it to their patients. So the IFM, that's an amazing, powerful and needable tool for any primary care physician.
Sure it is. And we understand the main subject for today is long COVID. So could you please let us know more about it and what is it? What is long COVID?
Something like 2.5 years ago, suddenly the world have faced something new that we didn't know at that time. And our focus was on the acute consequences of this virus. We were able to develop vaccines, we were able to develop different medication that can handle the acute phase, and we are doing good during the acute phase. And now we are dealing with the second phase, which is looking at the long-term consequences of this tiny virus. And this is what we call long COVID or post-COVID condition. Today we have a clear definition by the WHO, the World Health Organization, on this entity. It's long COVID condition. We are referring to patients who have a consistent symptoms more than 3 months after the acute infections that are non-recovering. These symptoms are very challenging because they are related to brain functionality. We are speaking about cognitive decline, attention, memory, information processing speed. We are dealing with what patients describe as brain fog in their daily activity, mental fatigue. Today we understand the pathophysiology, how the virus can penetrate through the cribriform plate, how it's causing the damage in the brain, and that will all be reviewed in that conference. We understand that the virus can also affect the physical capacity, the heart contractility, and we will bring also the frontiers related to that understanding to that conference. And we will bring the frontiers that we have today, what we have developed, what is under developing, what was already proved, and what is still under investigation, on how we can help those patients. So we will touch base on what is long COVID, how can we diagnose that, and what can we do about it. And this is a moving target. We are learning all the time, and we need to be able to give answer to our patient. And we will do our best to update anybody who will attend the conference.
Since you touched down on the subject of diagnosing long COVID, how can we exactly diagnose long COVID?
That's not for a short interview. That's a long discussion. But to make a long story short, it's challenging. Okay, we need to be able to evaluate the cognitive, the physical decline objectively, exclude other conditions that are causing that. And that will be part of the discussion and the presentation that we have in the conference. So you are all welcome to come, learn more about it, and I'm looking forward to meeting you.
Sure. And is there something that we can do?
Come to the conference, listen, learn, read, be updated, and do as much as we can to translate the frontiers in science to the daily clinical routine.
Perfect then. Thanks a lot, Professor Shai, and thank you for your time.
Thank you. Looking forward to meeting you all.